Sometimes the mind's strongest tool is silence. I want to talk about repression. Repression happens when the brain takes memories or emotions that are too painful and pushes them down so far that we don't even know they exist anymore. And you're not just ignoring them, you're not just choosing not to think about them. You literally don't have access to them because the brain locks them away. And for many people, that's the only reason they survived something that happened in the past, and it was in an attempt to maintain a sense of calm. So picture a child who grows up in a chaotic and abusive home. As an adult, that person might say, honestly, my childhood was fine. But later, a smell, a song, or a specific kind of stress cracks the door open. And then pieces of memory come rushing back. Or after investigating further, you find out they actually suffered pretty significant abuse or neglect in their childhood. Or someone survives a car crash, but says they can't remember anything about the accident. The memory is gone, even though their body still tenses every time they get into a car. Repression is not denial. It's not lying. It's the brain saying, this is too much to process. We'll put this in the vault. Here's what's going on under the surface. When we experience overwhelming trauma, the amygdala, which is the brain's fear center, fires hard. Stress hormones like cortisol and vasopressin flood the body. At the same time, the hippocampus, which normally helps us store and organize memory, can go offline under that much stress. The result? The event either doesn't get stored properly or it gets fragmented and then it's inaccessible. This isn't conscious. The brain is literally shielding you from yourself. Think of it like a computer file you have saved, but you can't open because it's not a PDF or the right format. The file is there somewhere, but you can't open it normally. Repression is a double-edged sword. Repression is protective. It keeps you from being consumed by trauma at a time when you had no tools to handle it. But the cost is that those memories don't just disappear. They stay stored in the nervous system, surfacing in other ways. Like nightmares, body tension, sudden panic attacks that feel like they are coming out of nowhere. It's like burying toxic waste underground. Yeah, you can't see it, but it leaks out over time, and that's in the symptoms. So healing doesn't mean forcing the memories back. It means creating safety and support so that if and when the memories return, you're not facing them alone. Therapies like EMDR, somatic experiencing, or trauma-focused approaches give people a safe container for memories that were once unmanageable. And sometimes repressed memories never fully return, and that's okay. Healing doesn't require remembering every detail. It just requires teaching your nervous system that the danger has passed and it's okay to move on. Repression is the brain's way of saying, not yet. You're not ready. And for many survivors, that pause was the reason they lived through the impossible. But you don't have to live in that pause forever. With support, it's possible to let the past surface gently, not to relive it, but to release it. Unlike repression, Suppression isn't unconscious. Suppression is when you know you're feeling something like sadness, anger, grief, and you deliberately push it aside. You tell yourself, not now. I can't deal with this right now. It's not forgetting, it's pressing pause. Think of a doctor who loses a patient. Then they have to go to the next room and take care of another patient. They don't break down in the middle of the shift. They swallow it, finish the work, and tell themselves they'll cry later. Or a parent at their child's recital. Maybe they just had a fight at home. Maybe they're grieving. Maybe they just had a death and lost somebody. But in that moment, they smile, clap, and tuck the pain away. Or a student heading into an exam. They feel waves of anxiety. They feel like they could vomit, but they tell themselves, I'll deal with this afterward. I can't deal with this right now. I have to pass the test. That's suppression. The reason it happens in the brain is because the prefrontal cortex, which is the brain's control command center, steps in and overrides the emotional surge from the amygdala. It's like slamming on the brakes when your emotions are just barreling forward. It's like, the feelings are still there, moving under the surface, but you're holding them back through sheer mental effort. This isn't always necessarily bad. Sometimes it's necessary to function and get through. In fact, it's one of the main reasons humans do function so well. But just like holding your breath, you can't do it forever. Everything is temporary. So again, it's a double-edged sword. Suppression can be incredibly useful. It lets you stay professional, show up for your kid or your people, or focus when you need to. But when suppression becomes the default way of handling emotions, the costs pile up. There's a lot of suppression working in the ER and in a hospital setting in general, in a medical setting in general. But I'm saying that because I worked in the ER. And there are so many times where you have to suppress your emotions to get through the rest of your shift. And I think that veterinary medicine would be another example that would be very difficult for me personally. Anyway, bottled up feelings eventually leak out as stress symptoms. Headaches, stomach issues, insomnia, burnout, and sometimes they explode all at once with anger, tears, or breakdowns that feel disproportionate to the trigger. But that's because it's all under the surface. It's like holding a beach ball underwater. The longer you hold it down, the more forcefully it bursts back up. The goal isn't to stop suppressing altogether. It's more about using it as a short-term tool, not a permanent strategy. You don't want to just go on default mode. Give yourself scheduled space to process emotions later on. So cut out time in your day where you do give yourself time to process things that you felt that could have been upsetting or traumatic. Allow yourself to sit with those emotions and sit in that discomfort for a little while, because that's important for processing. You can do things like journaling, therapy, or just even conversations with trusted people or one trusted person. Practices like mindfulness or grounding techniques can really help you notice when you're holding your feelings down, so you can choose when to let them up. Suppression is the pause button, not the delete button. And like a pause button, it's only meant to be temporary. When we learn to actually press play and to let the feelings come and go and practice mindfulness techniques, life gets fuller, messier, but much more real and much more fulfilling. And it's nice to be in the present moment and to process feelings as they come and let them go and then move on. And there's a lot of power in starting to recognize suppression and repression and understanding the difference between the two. So that's all for this topic, and thank you for being here. Bye.